I had read some of these journal articles. Restricting blood flow, good things are happening. I just kind of figured that I didn't understand what I was reading.
I looked it up and I'm like, so it's a cuff that you cut off blood flow to your, what?
We feel very confident about. Muscle growth will increase similar to that of high load exercise.
You slap some blood flow restriction on, now you can turn pretty much anything into a hard workout.
It's not a cure-all, right? But it does do a lot of beneficial things, especially if you cannot train traditionally.
Welcome back to the Dr. Layne Norton podcast. I'm your host, Layne Norton, and today I have one of my favorite people to talk with, hang out with, and somebody I consider a very pure scientist. And what I mean by that is he doesn't sell anything. He doesn't care if you agree with his data, if you disagree with his data. He's just going to tell you what the data says and what he really thinks. And that's Dr. Jeremy Loenneke. Now, I've known Jeremy for over 20 years. I first kind of ran into him on the bodybuilding.com message boards back in the early 2000s. Jeremy then went and did an internship at Illinois during his undergraduate year. While I was in graduate school, we trained at the same gym. We ended up hanging out quite a bit as friends, and he got interested in blood flow restriction training at Illinois. And then he went to Oklahoma for his graduate school, for his PhD. And now he is a professor at Ole Miss in exercise science. And when it comes to blood flow restriction, I don't think I'm out of pocket saying this. I think Jeremy is the foremost expert in the world on blood flow restriction training. And if you haven't heard of it before, we're going to describe what it is. But briefly, you're applying pressure to your limbs to reduce the venous return of blood. So you're not necessarily restricting the blood flow to the muscle, you're restricting the return from the muscle. And this appears to have some unique benefits and may have application for certain populations. And you're even seeing people in the gym do it more often now. I see it probably every month in various gyms, people doing some form of BFR, which pretty much didn't exist 5, 10, 15 years ago when we first started talking about it. And Jeremy has come with me to Australia on seminar tours. He has been at all of the big camps I used to run back in the 2010s, where I'd bring in experts. Jeremy was always one of the people who was coming and speaking at those camps, and always one of the crowd favorites, because not only is he very intelligent, good scientist, but he's pretty hilarious. And if you ever get a chance to sit down with him with a few shots of whiskey in him, really hilarious. Professor Jeremy Loenneke, which still feels weird to say, knowing that I've known this guy for, it's got to be 20 years, right, Jeremy, from the bodybuilding.com forums?
Yeah, back in the day. Yeah, probably around 2 decades.
Yeah, so it's so funny, man. I'll get people who will like walk up to me and be like, man, I've been following you forever. I've been following you since like 2015. I'm like, what? I already arrived back then. That's nothing. But then you get some OGs every once in a while that are like straight flex. And I'm like, they know. And your username was, if I can embarrass you, I still remember, will work for Andro.
That's right. That's right.
Oh, if only we knew then what we know now. So yeah, I've known Jeremy for a long time. Very excited to have him on the podcast here. He is a professor at Ole Miss, even though he still has the Oklahoma banner back in the background. You are a diehard Sooner, aren't you?
You got to represent the prestigious University of Oklahoma. But I'm on brand with the Rebels. I'm on brand.
I see that. Now, do they play ever?
They do now. Now that OU joined the SEC. So last year, we didn't have a functioning offense. But I feel better
when
about
you
this
say
year.
we, which we?
Oklahoma. Yeah.
So if it comes to blows, you're red and white all the way, huh?
Crimson and cream, absolutely. But every other time, go Rebels.
Gotcha.
Beat
Makes sense.
LSU.
Makes sense. All right. Yeah. You do. There are strong loyalties to where you do your PhD at. I know that Illinois doesn't have much of a football program to root for, although they were ranked this year. And I was talking trash to my buddy last week who played at IU, and that did not work out very well for me at all. I was like, I looked back at the text message. I said, this did not age well.
So, not at all.
All right. Well, I'm excited to have you on because you are one of the foremost researchers in the world in blood flow restriction. And before we get into some of the research on blood flow restriction, how did you get into this? Because, BFR, I'm leading the witness, but BFR is obviously kind of like an esoteric thing that really, it's funny now to see it become more mainstream, seeing what some of the comments were to it 10, 15, 20 years ago. But yeah, just give it a little background on like how you got into it.
Yeah, I had, as an undergraduate student, I had read some of these journal articles, and I've told this story many times, but I just kind of figured that I didn't understand what I was reading, right? That I'm like, this restricting blood flow, good things are happening. It just must be, my lack of understanding. Most people don't have that kind of mindset anymore, but that was my mindset. I'm like, I just must not understand what I'm reading. But then I went to Illinois for my internship and went to the mecca of natural bodybuilding at the time, Gold's Champaign. And that's where I saw you, Chris Foz, Gabe Wilson, kind of cutting off blood flow with I think probably knee wraps. And I'm like, what are you guys doing? And we got to talking, and then it's like, maybe I was reading that correctly. So then I just started reading kind of all about it. And then I went back to Southeast. I kind of did my internship project, so to speak, on blood flow restriction. And then my mentor at the time was like, I think you might be on to something with blood flow restriction. You should try to write a paper about this, like a review paper. And I'm like, yeah, I'll write a review paper. And then I drove home, and I'm like, what is that? Write a paper? What does that even mean? So it took me a long time to slowly work on that first paper. But yeah, a lot of credit goes back to you for sure.
Yeah, it's so, I tell people all the time in my career, there's so many moments where I made what was seemingly like an inconsequential decision, and it ended up having these huge ripples on my life, And yeah. This is example like for you, just to give background and context. So the amount of research on muscular hypertrophy, Jeremy, would you say in the last 10 years that explosion is a good description of it?
Yeah, absolutely.
We just, back in when I was in grad school, I got to grad school in 2004. The vast majority of your exercise research was endurance exercise, aerobic exercise. The research we had on resistance training was so rudimentary. It was kind of like, yeah, we know it builds muscle. Next. There was really no peeling back the layers into how this actually worked. We had theories on how it worked, a lot of which ended up being wrong. But I remembered in 2007, you were an intern at Illinois, and I read this meta-analysis of hypertrophy on hypertrophy training and resistance training. And I had never even heard of a meta-analysis at the time. And it stands to reason because there just weren't enough research studies to do a meta-analysis on hypertrophy training. And one of the sub-analysis they did was on what they referred to as Katsu training. And I was reading these results and I'm like, this is pretty impressive. They're getting noticeable hypertrophy in some of these trained athletes in 6 weeks. And so then I looked it up and I'm like, so it's a cuff that you cut off blood flow to your, what? And it's a certain pressure. And then I was like, well, how much does this thing cost? Maybe I'll go spend a few $100. It was $10,000 for the Katsu device. And I'm like, well, that's not happening. So then I still was kind of like, let's try different things. I'll try a band, resistance band, resistance brand. That didn't do anything. It was really uncomfortable. Then I went to those soft Velcro belts. I tried that. That seemed to work a little bit better. but it's still like, it's very thick, you know, the not the actual thickness of the belt, but the kind of top to bottom of the belt, the surface area it was covering. Yeah. And then I was like squatting one day with knee wraps, and you were around at that time when I was competing in powerlifting where I would use knee wraps. And I remember thinking, man, I get such a calf pump when I'm doing this. And then it kind of like, I wonder if I could use this for like leg extensions and stuff for BFR. Did that, and I'm like, oh, that feels different. That feels really different. And so, yeah, one day you came in, I remember the exact conversation, and you were like, what are you doing? And I'm like, explaining to you, you're like, that sounds stupid. And then you went and published a bunch of papers on it. So it is now, it's been called Katsu training. It's been called occlusion training, now mostly called blood flow restriction training, I believe is the accepted term. Okay, give us a definition of what is this? Like, what are you actually doing in a pragmatic sense?
Yeah, we're basically taking a cuff or a wrap and putting it at the proximal portion of whatever limb you're looking to target, right? So if you're targeting your quadriceps, we put it at the top of the leg. Really the only two places it goes is the top of the leg or the top of the arm. And you're going to pull it or inflate it to kind of a pressure that partially restricts blood flow into the limb. So there's always blood flow going in. There's just not a lot of blood flow going out during the rest period, at least. So when that's combined with low load exercise, there appears to be some good things that happen with muscle size, a little bit with strength sometimes, and then definitely with muscle endurance as well, local muscular endurance. But yeah, I think, some people will, there could be reasons why you would want to use a super high pressure. There's something called intermittent occlusion and things like that, where that there is some reason to believe that could be beneficial. But when we talk about combining with exercise, we typically are talking about using pressures that are subocclusive. So, anywhere between 40 and 80 or 90% of the pressure required to completely cut off blood flow at rest. So partial restriction. And
so what are some of the effects of blood flow restriction? Like what do we see from it? Because obviously, like, I was reading research on hypertrophy. You mentioned hypertrophy and with some strength benefits. What do you actually see from it in untrained and trained individuals?
Yeah. I'm much more familiar with the resistance training adaptations. Kind of as you mentioned earlier, my focus always in classes was always, where's the resistance training stuff? I want to know about getting bigger and stronger. And I don't, the aerobic stuff is important, but I care less about that to
Boring.
read about. But yeah, I think the adaptations that I think we feel very confident about, muscle growth for sure. Muscle growth will increase similar to that of high load exercise, and that's been observed lots of times in all different types of populations, untrained, trained, all different age groups. Strength, this is a lot of caveats. I think strength can increase from low load exercise with blood flow restriction, but it's usually less than that of high load exercise. And some caveats are if you are injured. If you look at some of the clinical data, sometimes then the strength data is actually similar, if not more than the high load exercise. But in normal, healthy people, strength will increase, but it's significantly less than that of high load exercise. Local muscular endurance, which for everyday life is probably one of the more important variables. How long can you sustain sub-maximal contractions? That's augmented substantially with blood flow restriction. Now, those are some of the more traditional adaptations that we typically talk about. Ones that we know less about, but I think are still useful. Tendon, that has some data behind it. Not a lot, but some, that suggests that maybe it's beneficial for tendon, which is a little bit different than what I would have expected. Same thing for bone. capillarization, like some of the vascular changes in blood flow, that does appear to be augmented by blood flow restriction as well, depending upon the circumstance. So yeah, it covers a lot of different variables. It's not, and as we've talked about before, and if you talked about too, it's not a cure-all, right? But it does do a lot of beneficial things, especially if you cannot train traditionally.
Yeah, so you said so many great things in there, and I want to point out, like, this is also similar data for low load training to failure. You do see similar muscular hypertrophy compared to high load to failure, but high load will give you better strength because strength is the practice of a specific skill. You could have the contractile muscular tissue to, I guess, have the strength potential for something, but if you don't train at a high load, your body strength is about more than just how much muscle you have. There is a lot of neurological drive that goes into it. There's also the issue of like technique. And then on a broader scale, it's also managing fatigue. I think that's actually some big noise in the data when they go to test strength in some of these studies is more fatigue versus less fatigue, because we know that acute fatigue can really affect strength. We can get into some of that later. And also what you said about, like, we care about, muscle. It's so funny. Thankfully now muscle is coming into the mainstream where it is being acknowledged for health benefits. Our friends Peter Attia, Gabrielle Lyon, big parts of that. Don Layman, big parts of that. Big part of that. But back, 15, 20 years ago, if you wanted to study muscle growth, you had to frame it as, we really are concerned about people losing muscle, cancer patients, elderly people, while secretly we were like, how do we get jacked? But this is exactly how you had to get funding, because you couldn't get funding for saying, we'd like to make people more jacked. And I can still remember Jeremy giving a presentation at one of my seminars I hosted, where he pulled up some myostatin knockout animals, particularly dogs. He said, notice how they're all smiling, and why wouldn't they be? They're jacked.
Yeah.
So
go ahead.
No, go ahead.
No, I just, this is how these things go with everything, right? So it's like there's especially in the exercise world, when I was going through school, it's like all about aerobic adaptations, which are certainly like aerobic exercise, and those things are important, but there was not a lot of focus on some of the muscle and resistance exercise. And now I think, as you said, there's a lot of people going, hey, these are a lot of beneficial things. But now it's, of course, overcorrecting, right? To where it's like, actually, the only thing that matters is muscle. And it's like, well, that's not true either. But yeah,
I tell
it's
people,
definitely...
I think one of the single healthiest things you can do is build a sufficient amount of muscle mass. But that doesn't mean that that's the only thing that you should do. I think cardiovascular fitness matters. I think other things matter too. But I do think it is one of the biggest levers you can pull. But of course, people conflate that with it's the only thing that matters.
That's right.
Just the culture we live in. Before we get into the mechanisms of how this stuff works, can you describe what are the normal protocols? Like, how would somebody actually do this in the gym?
Yeah, there's been some things that we've been doing recently that's a little bit different, and it may not be that useful for the practitioner, but I think it's very useful from a study design perspective. But basically, the way that you would apply it is, if you're going to do it in the gym and you're using wraps, right? Now there's a lot of commercial devices that are, probably pretty reasonably priced that you could probably use something to take your arterial occlusion pressure. So if you have that, that's awesome. Then, apply it between 40 and 80%. Use a low load, and then, do 3 to 4 sets of exercise, right? Under restriction during the rest periods. The traditional protocol was 30, then 3 sets of 15. I think that's a reasonable...
When you say 30, you mean first set of 30 reps and then 3 sets
Correct.
of 15 afterwards? Yep.
Yeah, with 30 seconds of rest to a minute between each set. Now, there's nothing special about that protocol. It's just what was done, and then people continue to do that. I think what some people will find, especially people who are stronger, is at 30% of their 1RM, they're not going to be able to get all of those repetitions. So I always view it as like a guide, especially there's a lot of people who don't know their 1RM on the knee extension, right? Or don't know their 1RM on lots of different things. So how do I apply blood flow restriction? So, put the cuff at a pressure that's, moderate. And if you can't do 30 repetitions in the first set, or if you can't get close to that, and the load is low, then it might be a little bit too tight, especially if you're in a lot of discomfort, right? So I would use those kind of things as a way to balance it, right? That's the practical side of it, trying to figure it out. The less control you have, the more self-experimentation that you have to do. But if you know that it's a low load and you get it close to 30 repetitions, and then you get close to, let's say you do 12 the second set, 10 the third, 8 the fourth, that's probably pretty good. If you don't want to mess with it and you know that the load is low, then do 3 to 4 sets to failure. That's also fine. Or do however you feel like it that day. It really comes down to making sure you're able to do a sufficient volume of work if your goal is growth, right, or some of those endurance adaptations. But that's how I would do it. And if you're interested in doing like chest, right, that's not obviously under restriction. So, or if you're under your shoulders, that's not under restriction either. So the only place it goes is at the top of the arm or the top of the leg. So what do? And I would probably superset it with something that is under restriction. So maybe you do a set of chest press and then a set of tricep extension, or a shoulder press and tricep extension. And I think you'll find that that's a pretty tremendous pump.
Yeah.
Now, of course, and we've talked about this in every seminar we've ever done, there will be people who listen to this who go, why don't you just do high load exercise? Go do that. It definitely works. If you don't want to do that, or if you're looking for other things to do, or if you're injured, try this. But I think one of the things that especially, what's so impressive about you is how you've been so motivated for so long in the gym. That is an astronomical feat for people to do. And I think some people can be robotic. Dr. Chris Foz, he can be a robot. I will do this and I will crush it in the gym for the rest of my life.
Yeah.
Right? I don't need to switch up anything ever to keep it interesting.
Yeah.
But some people do.
He's like Drago. He's like Drago.
Yes. Some people need to go, hey, I'm not as motivated in the gym. I need something to switch it up to keep me excited. Try this. You don't have to. It's something to try. Something you can use.
Guys, training is infinitely more complicated than nutrition. Where do you start? How many reps? How many sets? How close to failure? If you're confused about where to start with training, but you don't have the money to hire a coach to expertly guide you, check out the Biolayne Workout Builder. When you subscribe to the Biolayne Workout Builder, you get access to all my evidence-based programming. We have programs for every experience level, goal, and equipment availability. We even have programs for people with essentially no equipment and home gyms or hotel gyms or garage gyms, all the way up to fully equipped commercial gyms. We take all the guesswork out of the reps, sets, and intensity, but give you the flexibility to pick exercises that you prefer and have access to, while still making sure that the exercises that you may sub in are equally effective for building muscle. So if you're ready to take the guesswork out of your training, get strong, and build muscle, click the link in the show notes and sign up to the Biolayne Workout Builder today. I think the value of personal preference and adherence is so understated, because everybody just wants to find the biohack, the perfect thing, the best thing. And the reality is, if you didn't get results with your nutrition or with your training, it probably wasn't because you didn't have the perfect program. It was probably because you just stopped working hard, or you stopped doing it at all. People will look at like videos of these pro bodybuilders who are massive, and obviously like steroids play into it, but you and I both know at that level, they're all doing steroids. And then if you look at the pro natural bodybuilders, they're all they're all trained. All these guys train hard. Okay. And people will look at some of the training photos like Doug Miller, who's probably the greatest natural bodybuilder of all time. And then if you look at, say, Ronnie Coleman, one of the greatest bodybuilders of all time, Phil Heath, one of the greatest bodybuilders of all time, they all train very differently. It's like Phil only did machines. Ronnie was free weights. Some of these guys doing a lot of partial range of motion. Doug Miller, some people would consider it very sloppy form. What is the common denominator of all of these? And people will be like, well, how do they get like this when they train like this? I'm like, because they did it really freaking hard for 20 years. That's how. You can't even be consistent for 6 months. That's why they're where they are and you are not, right? And like, not everybody wants to be a pro bodybuilder. I get that. But again, and again, genetics matter. Not everybody's going to look like that. I know that I would put my training intensity up against anybody, and I still would I was a really good natural bodybuilder. I even won a pro show, but I was never going to be a world champion natural bodybuilder, most likely. And so genetics do matter, muscle insertions matter, all that stuff. But man, you can have some really great results if you just train hard for like 20 years. And I think so many people underappreciate that. And to your point, for me, one of the reasons I got into powerlifting was not because I felt powerlifting was best for muscle growth. It was because it got me excited to train, because I started doing it just as something to do in the off season from bodybuilding. Because if you're a drug-free natural bodybuilder, you're going to be taking 2, 3, 4 year off seasons if you want to actually change your physique. So I started doing that, not because I thought it was like optimally best, but because it got me excited to train. And I can tell you what, if you're excited to train, you go in and train hard, it's better than doing something that's theoretically optimal that you just go in and ho-hum it. And with blood flow restriction, one of the reasons I started doing that is, one, the pump is unlike anything I have ever experienced. Even with low load training to failure, the pump with BFR is just a different level. Yep. And then the second part is I was doing so many heavy compound movements. People don't realize powerlifting, it can be like physically challenging, but the mental challenge of having to like lock in for every heavy set, that's actually what's exhausting. And so when it got to like my other work, I kind of wanted stuff that was just lighter, that would help me grow more muscle, but wasn't really that taxing. And I enjoyed it. And like, people always sorry, I'm kind of going on a monologue here, but I think it's important for people to understand. People will look to me a lot as like, oh, you do this thing. Why is that better than everything else? And so many times I'm like, nah, it's not. I just like it. Like I still eat more carbs before my workout and after my workout, not because of GLUT4 upregulation and, this and that. Right. It's because I grew up in the era of Flex Magazine, and that's what they said to do. And that's what I started doing. And I just started doing that, and I've just never stopped. I don't think that me having a carb load before I go lift 3 reps is impacting my performance, Right. But I like it. So I do it, and there's nothing wrong with that. And I think people just don't want to say that because it sounds unsexy,
Yeah. The other thing too is when you're training for long periods of time, especially as you get older, the utility of blood flow restriction could be the times where you become you get tweaked in the gym, or you get a little bit hurt. And maybe this is a time where you could really utilize it to help you get back on track to your normal training. Because if you train for any amount of time, something is probably going to happen. It's another tool that you can use.
Yeah, so let's talk about that for a second. And it's funny because, Jeremy, people will like say, oh, Layne was injury prone. I'm like, not really. I've been lifting for like over 25 years. And yeah, I've went through some back and hip stuff like almost all power lifters. I just talked about it. Everybody else just stops posting their videos on Instagram whenever they get injured. They just, it's Throwback Thursday, And I did find BFR to be a really useful tool when I was injured, because when it comes to actually competing in powerlifting, for example, it's tough. You're kind of locked in. Like, you got to do the big 3 lifts. You got to find a way to do the big 3 lifts, because if you don't practice them, you're not going to be good at them. But when it comes to building muscle, man, there are so many ways to skin a cat. And unless you have a spinal column that doesn't work, I would argue you're almost never in a situation where you can't do something in the gym. Yeah, back injuries make it tough. Hip injuries make it tough. You can still do leg extension and leg curl. You can still do that stuff. And you can build good amounts of muscle doing that stuff if it's sufficient intensity. So I agree with you. Like, a lot of pain and injury, those things can be mitigated when you are able to drop the load really far down.
Yeah. So
that is a very useful application of BFR. Another one is if you are traveling and you have access to like a hotel gym, for people like me, okay, that's going to sound cocky. People who are pretty strong, hotel gyms usually don't have enough to really give you a good workout. But you slap some blood flow restriction on, and now you can turn pretty much anything into a hard workout. And I mean, the same thing, I was talking about it when COVID hit and people were stuck at home. I'm like, hey, get some knee wraps off Amazon, get some quick release medical tourniquets for your arms. Those are what I used personally. And listen, do some body weight squats or do some pistol squats or some braced lunges or whatever, curl some milk jugs. Like, trust me, you will get a good workout. It may not be optimal, but hell, it's going to be better than nothing. I can tell you that. So I agree with you. I think that it works best as a tool in those scenarios, or just if you just like doing it. Like, I just loved doing it. But is there any evidence that it's like somehow superior to like regular training to failure with like low load or high load? Is there any evidence of that?
For growth, I don't think so. There could be certain situations where we've shown sometimes that if you were to go to failure with blood flow restriction or go to failure without blood flow restriction, that the endurance adaptations that you get might be a little bit better with blood flow restriction.
Interesting.
We've recently finished a study. It's actually been published in EJAP, but where we looked at really, really submaximal, because that's really where I'm starting to see like blood flow restriction having its best effects is when you make it super submaximal, because then it's easier to study, right? If you use a sledgehammer approach, it's like with protein. You give 60 grams of protein, it's really hard to tease out different sources of protein because it's just a saturating dose. So the longer I started to study this, I'm like, am I sure that blood flow restriction is doing something? Because from a study design perspective, you need to know what the counterfactual is. So if I did the same amount of repetitions without blood flow restriction, what would happen, right? And that's really, really difficult to design a study to address that with blood flow restriction. So we came up with this way of just basing the protocol off of an individual's endurance capacity with blood flow restriction. That way we could randomize all the groups and then ensure that no one was ever going to failure in the blood flow restriction or the low load group. So when matched for the endurance capacity, blood flow restriction was better for growth. It was better for endurance. Not better for strength. But when we compared it to low load exercise to failure, it was basically right in line with it. Right, the growth was very similar, despite the fact that the volume differences were not even remotely close. One was so far submaximal, it was a joke. I mean, if you would have seen these people train, you would have been like, there's no way that's going to compete with this. But it did. Now, when we look at the endurance, low load to failure won, but not by much. So I think submaximally, and that's where I think it has some clinical ramifications too, is that, it's easy to just go to failure. It's like, yeah, but you don't have to, and you can get some robust adaptations. But if everybody does go to failure, I think it's pretty comparable. I think you could find some studies that suggest that the endurance might favor blood flow restriction, but with strength, with muscle growth, it's probably going to be pretty similar.
I like what you said, making the comparison to protein and the saturating dose. You're right. I think you and I would agree, based on the most common proteins on the market, whey protein is the highest quality protein out there, right?
Yeah.
And you especially see these differences at a low dose. If you give 10, 15, 20 grams of a whey protein, you compare that to a wheat protein, you're going to see some pretty stark differences in muscle protein synthesis. But if you give 60 grams of whey protein and wheat protein, I mean, you give 60 grams of almost any protein other than maybe collagen, which isn't going to do jack because it's like, for those of you watching, spoiler alert, collagen is like literally the single worst protein on the planet for muscular growth. I'm aware of no studies showing it ever stimulates muscle protein synthesis, but I digress. But if you give a saturating dose of most proteins at 50, 60 grams, you're not going to see differences in muscle protein synthesis because you've maxed out the signal. Same thing, I think, is a similar comparison for training to failure. You train to failure or pretty darn close, you've saturated that signal, and it doesn't really matter how you get there if you get there. Would you say that that's a reasonable conclusion?
Yeah. And really what I got into the habit of saying was, well, blood flow restriction to failure produces similar changes in growth as low load exercise to failure, but it's at a lower volume of exercise.
Yep.
Now, when you say that over and over and over again, that's true, but it also assumes that if the low load failure group was to reduce its volume, that it wouldn't see that. And that's why that recent study was so important, because it's like, okay, how do we design a study to where we can be sure that had they not had blood flow restriction, this is how many reps they would be doing, right? And how did it fare? Not very well for growth and endurance. You know, high load, as you've said before, there will be people who argue this, and I don't know how you can, with a straight face, sit there and tell anyone that low load to failure is going to produce strength changes similar to that of high load exercise. It's just nonsense.
Yeah, there's no
you will get stronger, but it's not close to what you see with high load exercise.
Well, and that gets to the point, which is a common thread that I have on this podcast, which is if you want to be able to answer the question, if you want to be able to get the right answer, first of all, you have to ask the right question. And then you have to design a study that answers that question. And the study design has to be appropriate. And you would be shocked. You wouldn't be, but people out there would be shocked how many smart scientists simply don't understand how to ask the right question or design an experiment to test it. And in this case, there's two different questions that are being asked. The first one is, what will maximize muscle growth? And in that case, if you train to failure or close to it, you'll maximize muscle growth regardless of how you get there, unless it's like super high reps. There's some evidence that what I would say is like they're not actually reaching failure, because if you're using 20% of a 1 rep max on a leg extension, you can almost always do another rep. You know, you're basically running out of, endurance capacity at that point versus maximal recruitment. So that the maximal question, no difference. But when it comes to, is it sufficient to have a response? That is a different question, right? Will it build muscle? And I think the clearest example of this is what you're saying. You kind of breezed over it, but I want to point it out to people at a lower volume of exercise. So the benefit in my opinion, the real benefit to why you might do blood flow restriction at a low load versus just training to failure with a low load is blood flow restriction will get you there with much less reps. You will reach it faster. And so it's just more convenient, I would say. And so on a per rep, the dose you get for hypertrophy is greater with blood flow restriction than normal low load training, but they both cap out when you start to get close to failure. But you will cap out with blood flow restriction faster than you will with low load resistance training. Would you agree with that characterization?
Yeah, and I think what you said earlier too is like there's a lot of roads that lead to growth, which is great, especially from the personal preference side, because some people who are interested in maximal strength, but some people are just interested in growth and just overall function and maintenance and things like that, then that's great because it probably doesn't matter too much. If you want to lift heavy, lift heavy. If you want to lift light, lift a little bit lighter. If you want to do both, do both. They're all going to converge at the same point. Some might get you there faster. I don't know that we know that, but it will end at the same spot. And if you're training for, the rest of your life, it doesn't really matter too much.
Yeah, no, I completely agree. And again, I always tell people, like, when you ask me a question that's pretty general, I'm going to give you a couple different answers. The first is going to be like when people, a great example is, Layne, what do you think about building muscle and intermittent fasting? I said, well, I think first of all, you can absolutely build muscle doing a fasting-based diet. In the research literature, is it clear that continuous feeding is better than, say, traditional intermittent fasting, like 16-8 intermittent fasting? There doesn't seem to be real differences there, especially some of Grant Tinsley's work showing this. But if you inject me with true serum and ask me what I think and what I do, I'm not doing any fasting-based if I'm trying to absolutely max out muscle growth, because you're not gaining anything from it, and there may be a small downside. So the question becomes, are you like me where you're a freaking nut job and you want to be the strongest, most muscular human you possibly can be? Or do you just care about building some muscle and looking good? Because those are two very different questions. And what you need to get one is very different than what you need to get another.
Yeah.
Jeremy, I think one other thing that's important to point out for people to address this, and you were talking about kind of at the lower thresholds is where you really see the difference. And I think two studies that stand out to me are the fact that you can apply, in untrained people, you can apply blood flow restriction to people who walk and you actually see some hypertrophy. And in people who are on bed rest, you can apply intermittent blood flow restriction and it attenuates muscle loss. Can you give some insight into the mechanisms behind that? And then let's talk about the mechanisms of blood flow restriction and how it works.
Yeah. I think there is, and I always try to talk about it in three separate phases, and some people love that and some people hate it. But I like to think about it as blood flow restriction by itself, blood flow restriction in combination with kind of low intensity aerobic exercise like slow walking or low intensity cycling, and then low load resistance exercise. And you're exactly right. There is some data, although there's some data, maybe accumulating data, that maybe it's not as strong as that first study might have indicated that, but there was some indication that inflating and deflating a cuff might be able to slow down kind of muscle loss or strength loss following ACL surgery compared to standard of care. So that's really cool, because that's suggesting, like, obviously you can't think about restricting blood flow or think about going to failure and then do all those things, right? So that would suggest that something is happening there potentially. Now, there are there are studies that show that. There's also several studies now that have come out that suggest that, hey, maybe we're not sure. But if that is true, what might explain that? It's a good question. I think one of the ideas that's put forth is maybe that cell swelling effect. So when you inflate that cuff, you're getting a cell volumization, that cell swells, and that can activate some of those anabolic cascades, right? So that's an idea, right? Now, you're right. There is some data that suggests that if I were to walk slowly with blood flow restriction in certain populations, that might also induce growth. How does that work? Well, I think I'm very skeptical of some of that, but I think it very well could be very population specific, even though they have shown it in athletes and things like that. I have a hard time with that.
Yeah, I'd have a hard time believing that.
But the way that I would think about it is, and I know that you're a pragmatist as well. You have to consume the information and then make a decision, right? So when you're training, it's like, okay, I have this, Maybe you're in a situation where I can do some activity, but I can't lift weights for whatever reason. Is there some utility in maybe I can walk slowly with blood flow restriction? Yes, there would be some reason why you might do that, and you could point to studies that would suggest that, right? Is it going to work? I don't know. You have to make a decision, right? And
there he goes. He's heating
something.
up.
you have to do something. Now, what might explain that? Maybe you get that cell swelling, but you're also getting some activation. So high levels of growth comes from activating a large portion of the muscle for a sufficient duration of time. Now, the next question is, what is the sufficient duration of time? I don't know. But it seems like it's related to activating a muscle for at least, some time period. The reason why I say that is because theoretically, if I do a maximal contraction, MVC, or like if I'm doing a front double bicep in the mirror like most of us do every day, if you're holding that, theoretically, and you're going all out, you're activating a large portion of your muscle. But that's not, if you just do it once, you're probably not inducing growth, right? So that would suggest that there's some time component.
And just for the listeners, we are starting to see some of that data where maximal isometric contractions for long periods of time do appear to initiate growth. It's questionable as to whether that's going to be comparable to actual resistance training. And then we're also getting data, I wouldn't say strong yet, but emerging pretty good data that holding a muscle in a stretched position for a long period of time, and I will say an uncomfortably stretched position, appears to induce growth as well. And actually strength gains too, very interestingly.
Yeah, we did some stuff a long time ago where we called it no-load training, where we had within subject model, which we now know has some problems with strength. But when we had people just maximally contract one arm over and over through a range of motion, but it was like they were posing. And we compared it to high load exercise. The growth was actually pretty similar. And to be honest, the first actual training study to document growth, to my knowledge, ever in humans was isometric exercise, Ikai and Fukunaga. And that was just repeated isometric contractions. Now, I'm partial to dynamic because isometric is kind of boring for me. I want to see something move because, it's hard when people do isometric. It's hard to know, am I doing a good job? Right. Like, I have no idea if I'm doing good or how it's being monitored because it's not moving.
There's no external feedback.
Yeah. And then with the last phase where you combine it with low load exercise, you're getting high levels of muscle activation. Now, we can talk about where does that muscle activation, why is it higher than it normally is? And we think it's probably because the metabolites that are produced from contraction that are usually flushed out are not flushed out. And that can help fatigue the muscle. And in order to keep force output, you have to keep recruiting more and more muscle. Now, one of the things nobody who listens to this podcast will care about what I'm about to say. But it's something that I think about because the name that we're using is blood flow restriction, which implies, and it intuitively makes sense, that it's due to the restriction of blood flow. But I don't know that we actually know that. Because you're also applying pressure. Now, when you apply pressure, that restricts blood flow. But is there something to that pressure itself? Now, for the practitioner, it's really irrelevant, right? It doesn't matter. But for someone like me, an academic, it absolutely matters.
I think it matters because sometimes if you really... So people get the wrong impression of me sometimes because I'll always say outcomes over mechanisms, which I still stand by. But if you can understand the underlying mechanism, sometimes you can actually figure out how to make an outcome more favorable if you understand what the mechanism is. And I think something I actually wanted to talk to you about as we're discussing these mechanisms is I believe, and I'm sure you know this, whether I'm because, there's a lot of stuff rattling around up there over 20 years,
Sure.
And I think I read something once, but I believe just naturally during resistance training, there is some natural blood flow restriction, or more so, and I think this is where you're going, pooling of blood in the working muscle. And it sounds like where you may be getting at is it's not the restriction that may be causing the benefits, but rather so the localization of blood in a specific area that keeps metabolites in that area. And I remember reading one review where they had said, the muscle releases autocrine factors like MGF, which is IGF-1 that's localized to the muscle, other kind of localized autocrine growth factors. And perhaps by creating this restricted state where blood is staying in one place, those growth factors aren't getting quote unquote washed out and are having longer time to interact with the receptors. What are your feeling or thoughts on those sorts of things, and how does it weigh in with the evidence that you've seen?
Yeah, I think where I was going with was, is there something to, let's say that I'm applying 200 millimeters of mercury because that's 80% of my AOP or whatever. Is there something to do I somehow sense that pressure? So is that in and of itself having some sort of effect? Probably not on growth, but maybe strength, for example. I don't know. It's really difficult to tease that out. But you're exactly right. When you do a contraction, like at a higher force or above a given level, some force, there is interruption of blood flow, which happens just with normal contractions. Blood flow restriction is different because you're largely pulling that in the limb. So your limb is swelling. And all those things that are produced in the muscle, some of those things are leaving. But not all of them. A lot of them are being pulled around that. And there was some data that suggests that, is there something to the metabolites in and of themselves, right? Does that in and of itself signal some of these favorable anabolic pathways, or is it just that they cause fatigue and they increase muscle activation? Now, I put a lot of stock in for a long time that there was something really special about these metabolites. And I still hold on to that possibility. But at some point, you have to just go, well, there's not a lot of evidence that this is the case. It might be because it's very difficult to really study that. But what seems like maybe more likely is that it's maybe having a bigger impact on that activation. And when you activate a large portion of the muscle, once you activate a fiber, that fiber is now being signaled to grow. You activate another one, that one's being signaled to grow, and that's why you're getting these large changes in hypertrophy.
And for everybody listening, this is one of the tough things with teasing out mechanisms, because you kind of assume a ubiquitous application, and we now know that tissues are very heterogeneous. And there's the macro environment, but there's also micro environments. And so to study a micro environment is so difficult, because we even know, long ago I used to think, well, localized muscle growth, that's BS. Because if I contract a muscle, it's contracting along the entire length of the muscle. Why? And now we know that maybe the bros were a little bit right about that, right? And because we do see some studies with localized different areas growing differently with different exercises. And as I was brushing up on satellite cell fusion and some of these things, and start to realize, man, muscle cells are so complicated, and there are so many things going on in these microenvironments that even after studying them for decades, we understand very little of. And so when it comes to muscular growth, the common thread that everybody's kind of hung their hat on, and I tend to think it is the dominant factor, which is we refer to as mechanical tension, which probably encapsulates a lot of different things, to be quite honest. People hear mechanical tension and they think, well, how much tension's on the muscle? And one of the things I have to remind some social media influencers is that mechanical tension is cumulative, because if it were not, then we should just all do the heaviest negative we can possibly control on the way down, and we're done. Now, the thing I struggle with BFR is that seems to suggest that mechanical tension may not be as dominant as we thought, because if you're able to get the same growth with less repetitions, less cumulative tension compared to like low load to failure or high load to failure, seems to suggest that it may not be as much of a dominant factor as we thought, or under this specific circumstance, perhaps some of these other mechanisms matter more. Do you have any thoughts about mechanical tension?
I think you're right. I think it depends upon how you're defining it, right? So the way that I started to just think about it is mechanical just being, a surrogate of high levels of muscle activation. And if that's the case, then it's just using metabolites to get there. And I think the way to think about it, to compare it to like something like high load exercise, if I'm lifting 80% of my 1RM, in order to move that load one time, in order to move it at all, I have to activate a large portion of my muscle at the very beginning of exercise. So you're already getting high levels of activation. Now with low loads, when you lift that, if you're lifting 30% that first time, you're not activating a large portion of your muscle. There's no need to. But as you produce those metabolites and cause that fatigue, you start to activate more and more and more and more motor units. And by the end, you're at the same spot. But how you got there was a little bit different. In one case, you took a car, and the other one, you walked, right? You both ended up at the same place. You got there different ways. And, like you said earlier, the analogy I used to use because blood flow restriction is very different than just the interruption of blood flow you get from a high load contraction.
For sure.
Right? Because, yes, they both interrupt blood flow, but as I use this analogy in your seminars before, where it's like a fighter jet and a Cessna, they both fly.
Right.
But it's not even remotely the same amount of flying. All right? Everybody would agree that's different.
Yeah.
So I think, you can fly, but it's a little bit different.
Yeah, exactly. The magnitude matters. And again, I would invite anybody, if you've never done BFR, it's hard to really understand if you like the pump, if you like the sensation of the pump, we know now that it's probably not a critical factor for muscle growth, at least not directly. I think it's probably more of a passive, along for the ride sort of thing. But if you like it, man, if you do blood flow restriction, you're going to get a pump like you've never imagined before. When magazines would say, or the pre-workouts would say, skin-splitting pumps. Now, if you want a skin-splitting pump, you do blood flow restriction.
That's right.
And some of the things you mentioned, and I think about mechanical tension as kind of this common thread that can run through these different ways, these different pathways to hypertrophy and how they converge. And if you just for a moment envision a muscle cell, which each muscle fiber is a cell for those listening, you don't know externally what's going on. All you know is I'm experiencing a significant amount of tension, and that is occurring for a certain amount of time. I mean, that's really the mechanical input that you're sensing, and whether or not you have to be activated or not. And to your point, if we think about mechanical tension kind of intersecting with muscle activation, it makes a lot of sense, because even if you're not doing as many repetitions, the muscle, because those other fibers are fatiguing more quickly, it has to get to that maximal activation faster. And so those fibers are still experiencing the same endpoint of tension by the end of that set. And so and it also explains why when we have people isometrically contract really hard, that they can get muscle hypertrophy, because it is experiencing tension over a certain period of time. If we have people stretch really hard for a long period of time, tension over time. So now I want to be very careful because some people will take this and go, I should do really slow reps because that increases my time under tension. And again, what I would say is it's less about that and it's more about the muscle activation and getting close to that failure point. I mean, that is where we ultimately wind up at the end of the day is, do you train hard? Because you have to get close to failure to experience, like, especially like the maximal dose for a set.
Yeah. Although I don't disagree with that. I think
if you disagree, please. I
don't disagree with long term. You know, you have to train hard for long periods of time. I'm still, the blood flow, the submaximal work that we just came out with, the growth was similar, but it's still. I think the part that impressed me about that is that we were so submaximal. Like, even at the end of exercise, after they've already received all this adaptation, we never even surpassed what they did at the pre-test through 18 training sessions. The takeaway is still the same. It's about muscle activation, right? It's about, and how do you get that muscle activation? In general, you have to train very hard. You have to make the muscle work hard, right? And that usually means that you have to work hard, because mechanistically, we talked about, it's about, probably with growth, it's about activating the fibers. And how you do that is probably different between high load exercise and low load exercise, with or without blood flow restriction. But once that fiber is activated, if you look at the gene expression response, it looks very similar to that of high load exercise. You wouldn't probably be able to tell the difference. How you got there was different, but everything mechanistically beyond that point looks very similar.
Yeah, I think what that suggests is that, and again, if you disagree, please let me know, because I love learning more stuff. And like, people don't realize, I think things are so polarized now. It's good for scientists to disagree and discuss things, because this is how we learn. Like, I learned more in lab meetings with Layman and my other lab mates, just throwing around ideas and having stuff get swatted down, than probably almost anything. So I think what blood flow restriction may do is, again, when you're at maximal dose of getting close to failure, no difference between groups. But at submaximal, as you mentioned, where you're not getting close to failure, perhaps you are getting a more, let me reframe it. When you do blood flow restriction, perhaps there is a much more steep incline curve to get close to that hypertrophy response and have a response at a much lower threshold versus regular low load training, where it just may be more of a gradual climb to get that dose response. But if you get close to failure on each, you wind up in the same place. It's just that BFR will get you there faster. Would you say that's a fair characterization?
Yeah, and it might just mean that maybe there's some other stuff going on that was washed out by just always going to failure with the blood flow restriction. But yeah, I think from a pragmatist point of view, just if you get to or near failure, the growth is going to be very similar no matter what you're doing. I mean, assuming you're doing more than like 2 repetitions, right? Not that, I mean, that might induce some growth, but if you're doing traditional training, and you're reaching failure, that's or close to it. And that's another thing. Like, I get the repetitions in reserve thing. I'm on board with the utility of that, but how that's been characterized, I feel like has been unfair to people who were studying this forever, like resistance training, where it's like, hey, you go to failure, that induces a large amount of growth, and then you have people go, well, if you stop 1 repetition short, failure is not necessary. It's like, that's not even really different, man. Let's be. You stop 1 repetition short, and then you'll get the people who go, well, if you multiply that by 365 days in a year, that's a lot of extra stuff. It's like, okay, I don't know of anyone who's studying muscle growth who was like, no, it has to be to absolute failure. I don't know of a single person who thought that. So it's like, I get all of these things sent to me where it's like, hey, you don't have to go to failure. It's like, I mean, I believe that. I mean,
Right.
you gotta get close to it. But yeah, that's a side note.
Hey, it's Dr. Layne Norton here, and if you are tired of fad diets, bro science, and spinning your wheels in the gym, it's time to work with the pros. Team Biolayne provides custom, one-on-one, science-based nutrition and training coaching. No cookie cutter plans, no BS. Just real science, real results, and my team of expert coaches who actually know what they are doing. Whether you're trying to build muscle, lose fat, or just stop yo-yo dieting, our team of expert coaches have helped thousands of people just like you get real results and sustain them. So if you are tired of spinning your wheels and you are ready to take your fitness journey seriously, head to the link in the show notes or go to biolayne.com/coaching and apply to work with Team Biolayne today. We don't guess, we assess. I agree. For the most part, I think scientists argue in the margins. I think most of us agree on the big stuff, right?
Yeah.
And when you hear us disagreeing, it's us bickering in the margins, right? And yes, if we look at the research, it does seem very clear that you can get the same amount of muscle growth if you get close to failure. And I remember Mike Israetel made a post a while back, and I thought it was a very, very good message, which was, some people would accuse him of not training that hard because he's stopping 1 or 2 reps shy of failure on his sets. Now, the first thing is you have to have trained to failure to know what your RIR is, what your repetitions in reserve is. If you have never trained to failure, you are a very poor estimator of it, I can promise you, because in research studies, people underestimate their failure point by about 5 to 6 reps, which is they will tell investigators, I think I can do this for 10 reps. And then when they are pushed in the study, they end up doing 15 or 16 reps on average. So Mike's point is like, no, I can do this kind of training because I know what failure feels like.
Yeah.
And I very much agree with this. I have done 10, 14 rep sets of squats to failure. I think you might have even been in the gym. Oh, no, maybe not. But I did a set of 480 for 14 one time, my highest rep heavy squat set. When I finished that, I couldn't even fully rack the weight because I couldn't lock out my back enough to get the weight into the rack. Had to have somebody come and help me. And then I laid down on the ground for about 20 minutes trying to muster the courage to stand up, because I was so freaking exhausted. You're telling me if I stop 2 reps shy of that, that's quote unquote easy training? No, that's because most people's failure point when they try to institute RIR and say they stop 2 reps shy of failure is they stop 2 reps shy of when it starts getting really hard. And
yeah,
you would be shocked, especially after you've trained for a while and learned how to grind through repetitions. You would be shocked at what you can actually push through when you push yourself. And I think anybody who's seen me squat in the gym, I remember Paul Ravella, the first time I ever hit a set of 500 on squat for 5 reps, I think it was the first time he ever spotted me, and he goes, "You did 1, and I thought I was going to have to grab you. And then you did like 4 more. So yes, you can stop shy of failure and get these benefits. And I think there are benefits to stopping shy of failure, especially if you're a strength athlete, if you are somebody who's trying to be a really great like power lifter, to help manage fatigue, especially on compound exercises, because training a squat to failure and training a leg extension to failure are not equivalent on your overall fatigue. So I do think that's beneficial, but it is still hard training. And I'm sure you've seen this in research studies with people who they think they're close to failure and they're nowhere even close.
Yeah. And I think the other thing to figure in there is if you're doing multiple sets, it's probably even less important that you get that close to failure, because you're going to start the next set probably in some level of fatigue, which will help augment that activation. So Yeah, I think if you do it, and it's the same discussion with blood flow restriction, right? If you do 3 things for your quadriceps, 3 different exercises, and then you're going to add blood flow restriction at the end, I mean, it's probably not doing too much for growth. I mean, you can only signal a muscle to grow so many times before it's just kind of turned off for that session. But yeah, no, I definitely. I think there's a lot of difficulty in the RIR regardless, trained, untrained, because even in the studies that are really controlled, it's like you always have some problem with anchoring, right? Where it's like, I got one more, and then I failed when I did it one more time. It's like, well, did you anchor yourself to do that subconsciously, you know? What if you would have said 2? Would you have somehow figured out a way?
Yeah.
But then again, it's just one of those things where it's like some of these things are fun to bicker about and talk about, and does it make a big difference?
Yeah, like I said, I think that these discussions, you know, it's funny. I don't know if you've seen the meme where it's like the Gaussian distribution bell curve, and on one side is the Neanderthal, and on the other side is like the very enlightened person. In the middle is like your average person. And on one of them, I think Dr. Pack put this up, but it was like, just train hard and do it for a long period of time. And then in the middle was like, you have to consider RIR, tempo, volume, blah, blah. And then at the other end of the enlightened person is train really hard for a long period of time. Right. And that is what the bros, most of them said that. Train hard, bro. Train hard. And yes, there are things more than that can matter, especially when you get to a high level. But a lot of it's that. The vast majority of it's that. And I think what you and I see, and I can see it various times during this discussion, you go, you just got to do the thing. Just got to do the thing.
Yeah.
Because you'd been involved in these seminars where we're talking to people, well-meaning people, but they're getting so hung up on stuff that just doesn't matter. And it's like, if you just took that brain power, that mind space that you're devoting to stuff that doesn't matter and poured it into just doing the thing, you'd have better results.
Yeah, I think you're exactly right. And I think that, you know, people are looking and they're I really like the podcast that you did with Dr. Layman. I like the stuff with the study design. That's something we put a lot of focus on in our lab, because a lot of what we get criticized for is like, well, you're using something that's not, nobody trains like that. I don't care. We're answering a very specific research question. I'm not doing personal training. Right. What we're testing is concepts that you can then apply however you see fit, right? But you're exactly right. I think that people are always looking for, well, this doesn't really apply to me. This doesn't apply to me. This doesn't apply to me. So I guess I'll do nothing, right? Or there's some level of uncertainty. So what do I do? It's like, well, there's always a level of uncertainty, but you have to ultimately make a decision to do something. What is it going to be, right? Those seminars were great. Interacting with all those different types of people, because I think that they're all wanting to know just like, what is the best way to do this?
Yeah.
And sometimes it's just start doing something and then adapt as you need to.
Yeah, I mean, you can't think your way out of an issue. You can't think your way into success. You got to just do some stuff, you know?
Yeah.
And yeah, there's some things that can matter, but none of it's going to matter if you're not doing the thing consistently like that. And I mean, that's, I think I've told you, and I've talked about this a lot. I almost got put on academic probation for my PhD, not for my grades, but because I was just not doing the work in lab, because I was shell shocked from how badly my first few experiments went and just stopped doing the thing. And Layman was like, hey, I don't care how many times you fail, just keep doing it. You're not going to get it perfect. And the best way to figure out how to get it right is to just keep doing it. And by God, if he wasn't right,
Yeah.
And I think one of the things people have to realize is you and I have a greater appreciation for this now, that you can be too bro and you can be too, it doesn't exist in a PubMed citation, so I don't care about it. There is a good, healthy midpoint there. And what I tell people is you have to understand that scientific studies are big, blunt instruments. They are going to tell you what not to do more often than they're going to instruct you of what to do. And application and coaching to individuals is an art form. Yep. Okay. And so a great example of this, Jeremy, and I talk about this a lot, is Chad Dolan, Mike's student from years back. He was talking about a circuit he had done in lab to look at, like, could circuit training be a good form of cardio or something like that. And as he's talking about the way the circuit is designed, I see people like feverishly writing stuff down. I just stop him mid-sentence and I go, Chad, why did you design the circuit in that particular order? And he goes, oh, because it was the only way, it was a 10 by 10 lab and it was the only way we could get two people training at the same time. Like a lot of the times, the 30 reps, 15 reps, 15 reps, 15 reps for blood flow restriction, that doesn't mean that that's best or that's magic. That's just what they did. Yeah. And you don't know what the constraints in the research study was that forced them to do that, right? So it's important to, I think scientific studies are very, very important, but they also can be overinterpreted and over-applied. On that note, I want to wrap a bow up on this because I do actually want to talk to you some stuff about study designs. For people to apply blood flow restriction, what would you generally tell them? Somebody wants to start this. What would you generally tell them is a good guideline? And I know some people will ask, is this dangerous? Restricting blood flow, is this dangerous?
When it's applied appropriately in overtly healthy individuals or even those in some clinical settings, it appears to be relatively safe, right? The big factor I think that people focus on, rightfully so, is the fear of blood clots. But there doesn't appear to be data in the studies that have been done that shows that that's a major risk, right? There's always a risk for blood clots. I mean, you're restricting blood flow. The question is, does it increase your risk? And it doesn't appear to. Now, I think the thing that, blood flow restriction has increased in popularity substantially, and it's used at every major university in the athletic departments. It's used by major soccer clubs in the Premier League, right? It's used in the NFL, it's used in the NBA, it's used in Major League Baseball. I mean, it's used everywhere. And I didn't have a good appreciation for this as a student, but because it's always really difficult to know, like, is it really caused by blood flow restriction? Because what we will start to see probably in the next 5 years is the rare cases, right? Because there might be some rare case that somebody has that we don't know about. If you apply blood flow restriction, that actually you probably shouldn't be doing that, right? But it's rare, which is why it's very difficult to detect. In the studies, and there's been lots of them, I mean, we do training studies, and I pride myself on our lab. I mean, we do training studies with like 200 people, right? So we're not training by the way, 12
for people listening, that is a large number in a randomized controlled trial. That is a lot of people. So, it only works because my students are phenomenal. Like, we have they train 3 times a week, over 100 people per week. They're incredible. But doing that over and over and over and over again for years, how many negative responses have we seen? None that I know are due to blood flow restriction. And studies that are looking at safety see very similar things. I'm not naive. Like, I'm sure there is some condition where when blood flow restrictions applied, and maybe they did have something negative happen.
But in the clinical populations that have been used that are already at an elevated risk, they haven't reported anything happening in those studies. So I think for most people, it's probably pretty safe, especially if they're applying it for short periods of time at a moderate pressure, right? If you apply it all day for a week, yeah, that's probably not good, right? But when you apply it for minutes, right, which is what we do at a partial restriction, 3 to 4 sets of exercise, take it off, right? Or maybe you can work up to where you can do a couple exercises in a row, then take it off, right? That appears to be relatively low risk. There is a risk, but it's relatively low.
Yeah, and what I would say is there's no evidence that there's a risk outside of the normal risks of resistance training that is specific to blood flow restriction. And people have said that, well, what if the tissue becomes necrotic? We haven't. There's no indication that there's that. So especially the fact that it is a very acute application of blood flow restriction. So on that note, if you were going to have somebody start this, how would you have them do it? How do you apply it?
Yeah, I would have them, start especially if they're completely naive. Pick an exercise, something where you can isolate, like a bicep curl, a tricep extension, or a knee extension. Most people will probably use it on the lower body. I would pick a really light weight. I would apply it to a pressure that would allow me to get close to 30 repetitions, right? So I would have to, if you're applying the wraps and you're already in pain and discomfort before it even starts, it's too tight. Right? The discomfort should come from the metabolites, not from the wraps themselves. So if you apply it and they feel scientifically snug, right? It doesn't have to be right on between right and left leg. If you have one a little bit tighter, I wouldn't stress about that. And you could do 4 sets to failure, or you could say, hey, let me see if I can get close to 30 reps. And if you can, good. You get close to 15, close to 15, close to 15. It's going to drop off if you get fatigued, especially for the stronger people who listen to this podcast. I think that's a good way to start, because then you can start to see, okay, and do it once, right? And see, how do I respond, right? There might be certain people, and this is some of the stuff that we're studying right now, because some of the concern is maybe there's certain populations who get when you pull metabolites in a limb, that can signal blood pressure to increase, right? And the blood pressure increase is not over what you see with normal exercise. But there could be some people who are super sensitive to metabolites. So what we're trying to do right now, and this is extremely difficult, is to see, is there something we can do to screen people to see, can we predict who might have that response? All right, that's what we're working on right now, and it's going to take us a long time to try and figure that out, if we ever figure that out, right? To isolate individual responses is extremely difficult.
So hard, so difficult.
But yeah, I would see, how did you respond to it? Did you feel good about it? If you had an adverse event, then maybe you can start to reevaluate. Now, the one thing I'll tell you is that you're going to be extremely sore. Even if you're really trained, you're going to be very, very sore. Why is that? I don't know. I don't know what causes soreness.
I think one thing we can say about soreness is it seems to be related to a novelty stimulus. And so this will be pretty different than most people are used to. I can only give my feedback, and I don't do it so much anymore, but I did BFR for probably a good 10-year period very frequently. And as Jeremy said, you apply proximal to the limb, so upper arm, top of the leg, even if you're doing calves, top of the leg. And I did the 2 protocols I would do is the 30-15-15-15 with 30 seconds of rest in between each. And it's said to be, at about 20% of a 1 RM. Who knows if I was actually at a 30 or 20% of a 1 RM.
Yeah.
The way I gauged it was, by the time I got to the 4th set, I sometimes couldn't complete all the repetitions. I'd get to 13, 14, I might hit failure. During the first set, it was not really uncomfortable until right near the end. and then it started to get a little bit uncomfortable. But then very quickly in the second set, probably about midway through, got very uncomfortable, and then was uncomfortable throughout the next few sets. And that was kind of how I judged if that was about right for me in terms of pressure. And I think I got this from you, with knee wraps, I would use on my lower body. And I would go about if 10 out of 10 is as taut as I can pull the wrap, I do about a 7 out of 10. And on the upper body, I would use these quick release medical tourniquets. And I think because they were thinner, I had to get them tighter. So I'd kind of ratchet them down about as tight as I could and use the same sort of metrics. So that's how I did it. And then the other protocol I would use is there was, I think this was the study in rugby players like back in like 2005 or 6. First set, 15 reps with 50% of a 1 RM, which is a little bit nicer because probably a little bit easier to determine for most people. You get a little bit closer with that. 15 reps and then the next 3 sets to failure. And usually I'd go like 15, then 11, 10, 9, 8. Like I'd kind of drop off a rep each set. And that was kind of what I did with BFR for a really long period of time. And both those methods worked. Both of them worked in terms of the sensation I got, in terms of the response I got, and never had any problems with it other than getting a really nasty pump.
Yeah, I think the workload thing can be a real guide, because that's going to be somewhat related to how much blood flow you have, right? So if you're not getting very many and you know that it's very, really light, then that tells you already that you're restricting a lot of blood flow. So I think the using it as a guide is good. 7 out of 10 for some people is very unreliable.
Yeah.
But the workload, I think, is a useful kind of pragmatic thing. And the other thing that it brings me to, kind of reminded me of, is that there does not appear to be a benefit with growth or strength to applying it with high loads. So you start to flirt with the idea of when you get to a certain load, it's like you might as well not even use the restriction, because its benefit for some of those adaptations is with a really, really light weight.
I think the reasoning behind that would be at a high enough load, you're already activating enough muscle fibers that you're saturating that growth signal. You don't need, like you're defeating the purpose by including BFR at that point. Yeah.
All you're doing is inducing discomfort.
Yeah. Okay, let's switch gears for a little bit and talk about something that we may disagree on here. So the relationship between strength and hypertrophy. I know you have been I don't know what your exact position is on it now, but I know you'd been a critic of it previously, and I don't want to mischaracterize your position. So can you give me your position on the relationship between strength and hypertrophy?
Yeah. I think there's no doubt that if you were to group everybody on this campus and test their muscle size and test their muscle strength, there's a direct relationship between those two. There's no question. People who are bigger are on average stronger, no doubt. Although the messaging is changing in the textbooks, thankfully, but the traditional discussion of this and how I was taught and how I taught and how I operated for years was, if you want to get stronger, that's first due to neural adaptations, followed by large contributions from muscle hypertrophy, right? And there's a couple classic studies where that verbiage comes from. One of them that's most commonly cited doesn't even measure muscle growth. That's a whole nother discussion, right? But I operated under the assumption that muscle growth was very important for many, many, many years, up until I started to see stuff in my studies, and then I'd have students bring it up, and I'd try to explain it away, and then it starts to get to a point where it's like, maybe I should go back and see, why do we think this in the first place, right? And I did that with, one of my students. We went through all of these textbooks and we found all the papers. And we started to realize that the evidence for this is basically weak to non-existent. And as far as I'm aware, the only ones that have really tried to experimentally test this is us, right? So my position is this: people who are bigger are stronger, right? On average. Now, you can look at that and train people and go, aha, right? This guy's a freaking idiot, right? But you see the same relationship in people who are untrained. So I think that tells us that that might be explaining different things. That might be a development, right? Because muscle growth, right, from exercise, those mechanisms are completely different than muscle growth when you get older, when you're just from developing, right? May even be different from stretch. Who knows, right? So I think that we have to be aware of what is it that I am actually discussing. So my point comes from when an individual undergoes resistance training, an adult, when an adult starts lifting weights and they get stronger, why is that, right? So we've tried to look at that and experimentally manipulated how much muscle mass each group gains to see what effect that ultimately has on strength. We viewed that as kind of a knockout kind of model, right? You can't do a knockout, but can we get close to that? So we did that. We've done that many times, and we don't really see an advantage to that growth, right? Even if doing high load exercise. So to us, that suggested that, okay, maybe there's not a lot of evidence for that, right? Now, the limitations and the pushback against that is, well, you've looked at that to 6 to 8 weeks of exercise, right? And that's true. It might very well change at 1 year, 2 years, 3 years. I don't know. And my point is, neither does anyone else, because the studies that were used to develop this narrative in the first place were on 6 to 8 week studies, right? We even have more training sessions than Morton and DeVries did. So I'm open to the possibility that muscle growth could contribute to strength. But I think that has to be followed up with, there is no evidence that that's the case, right? The follow-up to that would be, well, if you really are observing muscle growth, how is it that you're adding actin and myosin, but that's not doing anything? And it turns out that when you add myosin, that is much more complicated than I ever imagined. There's the myosin heads, not all of them are available for force production, right? Some of them, it's possible that you add them and that they're in the off state, right? That they will never contribute to force production at that time. So I think that might explain that. Is that what explains it? I don't know. It's an idea about how you might be adding myosin, but how it might not be leading to force production. Now, the best criticism against us came from Nuzo, where he suggested, hey, I get what you guys are trying to do. I'm on board with that, but I think the study protocols between them were slightly different, right? So in order to elicit differences in growth, you use slightly different protocols. One of them was training at a high load, but with basically a 1 RM. One of them was training with a high load, but like 8 to 10 reps, right? So those are two different things. So he suggested using statistical mediation to try and get at this. So we've done this now 3 or 4 times, and we found no evidence that it mediates it, right? That doesn't mean it doesn't. It means we find no evidence that it does. So my position is, especially since people have to make decisions, right? But people also want to be evidence-based, right? And as you say, data, not feelings, right? So my position is that there is no evidence that the change in muscle size with exercise will make you stronger, right? It might very well, but there's no evidence that that's the case.
So I want to be very clear about what Jeremy's saying here. And I think really the difference between evidence-based and not evidence-based a lot of times boils down to how you specifically word things versus what people think you're saying. So let me give an example of this. I don't think we are going to disagree as much as maybe I thought we were on this topic. He is not saying it absolutely does not contribute to it. What he said was there's no evidence that it does, or no good evidence that it does. And so that is a very different thing, the claim that's being made. And I just want to point that out because I say all the time, I give opinions that are not supported by data all the time, but I will tell you that it's my opinion. I will tell you, hey, there's not really good evidence of this because it's an opinion, and you're fine to have an opinion as long as you call it out as an opinion. What is into the realm of charlatanism or non-evidence-based is when you state opinions as fact. So I just want to call that out because the way you frame that is really important.
Yeah, and I think we could state that, and this is I use a lot of analogies because people get really upset when I talk about this. I think it's fair to say that we've provided some pretty good evidence that it might not play that big of an important role, at least in the time frame that it's been studied, right? And I think that has some practitioner kind of utility. But the analogy that I would say is, let's say that the tables were turned, because people will they'll criticize the studies that we've done, which is fine. That's what science is. Science is, if you're looking to be complimented, science ain't for you, right? Because in my lab meeting this morning, I get disagreed with by every week, right? But what I would say is that if you just pretend like our studies were never done, you're still left with nothing, right? And the thing that I would ask people to at least entertain is, let's say for whatever reason that the narrative was not neural first followed by hypertrophy. But let's say that I came on here and said, hey, I have this idea that it's neural first followed by hypertrophy. And it was up to me to use the evidence that is used to convince you otherwise. And I would go, people who are bigger are stronger. And then the obvious retort would be, okay, yeah, but you see that in untrained people, right? And I would go, yeah, but when people lift weights, they get bigger and they get stronger. Those two things are occurring together. And then they might go, yeah, but that Loenneke guy, they show that, you could have growth, but you're not stronger. So I think there's a lot of weight put on the fact that it was believed that way to begin with, right? Now, from a practitioner, what do I mean by that? Is the evidence, as far as I'm concerned, is against that, at least in short time frames of growth being important, right? So what does that mean for a practitioner or for a coach? Does that mean that you shouldn't do hypertrophy work if you're interested in maximal strength? Maybe it means that you can spend less time doing it if you have because that's what takes a lot of time to recover from, right? So maybe you spend less time and you spend more time on things that you absolutely know matters for strength, which is lifting heavy, right? But I would never tell someone, and I don't believe I ever have on a podcast, to say, if you are a coach and you believe that muscle growth is important and you go, look, I get it. I understand that maybe it's a small role. Maybe it's much smaller than we thought, right? But I think it's important. And then you don't have your athlete do that. That would be terrible if you were a coach and you're going against what you believe to be the case, right? But I think you have to be honest and go, the evidence for this is basically weak to non-existent, and it's off of some baseline correlations that are seen in untrained people, right? That's where I'm at. And then people will retort and they'll go, what Jeremy doesn't understand is that there's a lot of things that are involved in strength, like your lever arm length. I'm like, your lever arm length is not changing with training. We're not talking about the same things. I'm talking about when someone exercises and lifts weights, right? Their legs aren't getting bigger, right? Or longer, rather. They might get bigger, but they're not getting longer. So what does that role play with strength? That's where I'm coming from. So,
yeah, so I'll give my take here. I don't know if we're even that far off, which is if you want to get strong, like the fastest way to get stronger is to do very heavy weights as frequently as you can tolerate. You'll deal with some short-term fatigue management stuff, but I mean, Mike Zordos's daily maxing stuff has shown that, like, if you can tolerate it, doing frequent 1-rep maxes is the fastest way to get stronger. Are you building a lot of muscle doing that? Probably not. Now, you will, I think where people have difficulty with the idea of strength and hypertrophy is, hey, I'm stronger in a squat than a lot of people with a lot bigger quadriceps than me, right? And I'm probably within a few pounds for sure, the same lean mass as I had 15 years ago. I mean, it's got to be really close. And yet I am enormously stronger than I was at that time. Now, here's what I will say in defense of hypertrophy for strength training. There's a lot of inherent characteristics that go around strength. There's the skill application. Yes, your lever arms make a difference in terms of like your maximal strength potential. Most of the best squatters in the world, they don't look like me, which I'll give myself a shout out. The fact that I was so good at squats, even though I'm not built like a squatter. They're built like Bryce Lewis. They're built like Pistons. They have very short femurs for the most part. Best deadlifters, really long arms, So those things matter, right? And so you can have strength outcomes that are discordant with somebody's lean mass or muscle size for a given area. But I would say, and again, this is you inject me a true serum, what I really think, all things being equal, me as a human being, as a person individually, if I added significant cross-sectional area to my quadriceps, on balance, I think I would be stronger in the squat. But that is a very difficult thing to tease out in a research study where, one, your participants all have different baseline genetics. They have different, I think one of the things that doesn't get talked about a lot is, hey, how long have they been training if they are trained? Because 2 years training versus 5 years training is a huge difference in terms of your growth potential because it drastically drops off over time. And just the fact that so many of these things, they happen together, but and so picking them apart and trying to isolate them is so difficult. So, okay, I've given you my take, and I would love to hear your feedback on what I said.
Yeah, I think the thing that I would say is,
it's okay, you can be mean.
I think we have to be careful we have to think about where did the initial dialogue come from, right? And it's based on these studies of untrained people that made certain claims, right? And because one of them also had his own textbook, it became very, very popular, right? So I think sometimes it's like, why are we defending it so heavily when it has almost no evidence behind it whatsoever? And sometimes it's because we're trying to make sense of that initial statement, right? But yeah, I think, I also think that it's difficult because I'm not an idiot. I can see why people would make that connection, right? We see this baseline relationship. We're adding the sarcomeres, right? We're adding actin and myosin, right? The thing that we know works with contraction, that is the contractile apparatus, right? But we're assuming that when it's added, we're assuming that those myosin heads are able to contribute to force production. And given the disconnect that has been routinely seen, it might be fair to say that maybe they aren't, right?
Or it's certainly not. Or I think the other argument you can make is if they are, it's possibly not a 1-to-1 ratio, right? Where there are a lot of things that you get diminishing returns for, or perhaps up to a certain cross-sectional area or certain number of units added, you do get a fairly linear response. And then after a certain point, you get no more response. And I'll use the example of a protein volume. I mean, these things, there does appear to be, volume per session, let's say. You get to a certain point and you've kind of, for lack of a better term, saturated it out.
Yeah.
All those things can be at play. And again, even though there's been an explosion of hypertrophy research the last 10 years, we're really just starting to scratch the surface of some of these underlying questions.
Yeah. And I think we've, the issue that we have with trying to figure out strength is that we've created this dichotomy, which might very well be a dichotomy. It might very well be neural and maybe hypertrophy, although, again, no evidence, but maybe. I'll leave it there for the discussion. But what it's turned into is, I think, a major problem. Is that if you see changes in strength, right, and you see a change in muscle size, it's automatically assumed that it contributed, right? If you don't, it's automatically assumed that it's neural, right? And it's like, well, does it have to be those two things, right? The neural component makes a lot of sense, but that evidence, as intuitive as it seems, a lot of limitations with that as well, right? A lot of limitations with the equipment. Although I'm on board with the fact that there's probably something going on with the nervous system. I think that makes a lot of sense, and I don't think anybody disagrees with that, right? I think the disagreement comes because people will always go, they'll try to, Dr. Abe used to do this to me, maybe it matters less, but on the level of importance, I'm like, but the problem is that we're assuming that it's important, right? I think that's an assumption. And I didn't always think like this. My early papers are written completely different.
You are right that it is very hard. An initial bias towards something can just be accepted and can be very difficult to walk back. And one of the fundamental jobs of scientists is to question their core beliefs. I tell people all the time, they say, well, like, for example, calories in, calories out. You just accept that as true and you don't believe any of that. I'm like, I actually challenge that all the time. Like, I try to challenge it all the time because I'd rather prove myself wrong than some idiot on YouTube, quote unquote, prove me wrong. Right. So yeah, I'm always questioning about whether or not, I mean, like it goes pretty far. I actually question whether or not we're in an actual reality right now and the multiverse and all that kind of stuff. Like, so you don't really want to go down that rabbit hole with me. But assuming that what we observe is actually true and not a simulation, I question a lot of things, right? And I think that's the job of a good scientist, but I think that can go too far where questioning is also equated with truth, or the I'm just asking questions fallacy, which I freaking hate. And you have to really, I think Hitchens' razor is a great kind of guide, which is extraordinary claims require extraordinary evidence. And if you can assert it without evidence, you can dismiss it without evidence. And it is on that continuum. If you want to make a strong claim, that's fine, but you better have strong evidence to back it up, which is one of the reasons why I say, hey, when you see me plant my flag really strong, you should probably pay attention because I don't do it very often, And I think what your point is and this is just the challenge with resistance exercise in general and exercise in general, there's so many things happening at the same time that you can't placebo them, because how are you going to placebo like blood flow restriction, for example? You can't. There's no placebo for that. Or there's so many things happening in synergy, to try and pick them out even in a rodent model is virtually impossible.
Yeah. I did think about a situation where you might be able to do it if you were able to drug someone, put them asleep, and then e-stim them, right? With and without blood flow restriction. I was thinking about that actually 2 days ago.
The Ole Miss IRB, don't listen to this.
Yeah.
So I want to actually press on this a little bit. So you've talked about the misinterpretation of studies. I talk about this a lot as well, more so the hot takes on social media. But there's so many times where I'll see a headline of a research paper. I will go to the research paper. I will read the results, read the methods, and I go, and then I read the conclusion from the researchers, and I go, your data didn't actually show that.
Yeah.
So you've talked about that and the replication crisis, especially in exercise science. So what do you think are some things that scientists could do to help? You can never eliminate this problem, I think, but make the studies higher quality and more reproducible in the field.
I think the easiest thing, and this is, for me, I don't feel like it was ever conveyed to me how important it was to have a non-exercise control group, right? Because the way that I would think about things, and the way that I would have said it, even when I started here, our early studies didn't have, we were comparing, we were saying this group can be better than this group, but we were also making claims about changes. But technically speaking, you can't make claims about exercise when everybody is exercising.
Right.
Right? So, and I think that for me, I would have said, come on, dude, you're being pedantic. And it's no, I'm not, actually. Because you need a time-matched non-exercise control group to quantify what would have happened had you not been in this exercise study. Right? And of course, randomization of that group is important, and we have a paper on how to maybe do this with resistance training populations as well. There's some things that you could do.
Okay, I'm just so stop you there.
I think that's
the reason this is tough, and people go, "Why don't you do studies in bodybuilders or this?" I'm like, because okay, guess what? If you're going to do a non-exercise control group and people who resistance train, guess what happens when you randomize people who like to resistance train to a group that's not resistance training? They go, bye-bye,
yeah.
See ya.
Yeah, one of the things that, we've kind of discussed is you could use a control group because why the control group? Because some people would say, if they're not exercising, do you really think they're going to increase muscle size and strength? No. They might increase strength a little bit because of the effect of doing the test one time. But the effect size, the mean change of muscle growth of a control group will be basically zero. But that's not why you're doing it. You're doing it for the error around that zero, right? You need to quantify that. Because what most people do is they'll do a time effect, which is basically the change at post relative to zero with no noise, right? So I think that if we think about what is the purpose of the control, to control what would have happened had they not been in this. Well, maybe you can have an untrained group of people that can serve that time point or time frame. You can also have a group randomized to just continue with their normal training. And then you can have that resistance training group that's doing what you want them to do, right? And that might be a way there's problems with it, of course, and strength training people are really challenged sometimes to work with. But I think that might be a way to do it. But I think that the control group, is important, because then you can quantify. It would be the way that I describe it to my students, because, again, I'm not coming at it from some place where it made sense all my life, because it didn't make sense all my life. But if you look at most exercise studies, most of them do not have a non-exercise control, yet they're making claims about exercise. But the way that I would think about it is, can you imagine like a drug, vaccine or whatever, a cure for something, where it's like you go look at the study and it's like, what'd they compare it to? Everybody got it. Well, how do they know if it worked?
Right.
They just know, right? It's this. We give exercise a lot of passes, and I don't know that we should. And the thing that pisses me off is when you bring it up as a limitation, right? Where I go, I know why you did this. I know why, and I understand it, but it's a limitation. And then somebody might go, well, we did it because of this. It's really difficult, and it's really hard to recruit an extra group. No, I understand, but it's a limitation of the design, right? I'm not saying that your study doesn't tell us anything, right? I think that's a crazy view. If you go, well, it doesn't have this design, I can't take anything from it. Nothing? You can't take anything? That might be true, right? But usually you can take something. But it's like, it is a limitation.
Jeremy, what you just said is so important. I say this all the time when people say to me, this is a bad study, right? I go, very rarely will I say something is a bad study. I might say, I don't agree with the interpretation of this data, or I don't think this was designed in a way that actually answers the question that they wanted to answer. But the data is just the data, and every study has limitations. And yeah, you can have some really elegantly designed studies that are executed really well, who ask the question right and test it right. And so we are more likely to put more emphasis on those studies and more broadly apply their outcomes. But it's still just data. And it's how it fits with the consensus of the data that matters. And that's why, I mean, I'm sure you know this. I just don't get excited about single studies anymore. A little bit.
Yeah.
But I have just seen so many times where it's a single study pops up and you go, whoa! And then nobody ever replicates it because it wasn't real. Not that it wasn't real. I have to be very careful here because I think a lot of people, they think when that happens, it was completely fabricated. And that stuff does happen. I think it's mostly rare. I think what more happens is, one, either very poorly designed studies, poor statistics, poor interpretation, or, hey, listen, p-values less than 0.05, significant, okay, but guess what? Random chance is still random chance, and sometimes it happens. And sometimes you can have weird results that aren't replicated because they were just a random result. And so that is why replication is so important. And that's why when people go, well, I don't worry about scientific studies because they all contradict each other. Well, that's not really true, okay?
Yeah.
And that is why we care about replication over time.
Yeah, and I think that, I think people usually think it's something nefarious, right? But even like publication bias, I don't think that it's actually usually done in a nefarious way.
No.
I think what people will do is, and this is why when we're coming up with some sort of idea, or maybe it's a secondary analysis of something else, we have very serious conversations in the lab where it's like, okay, we have to think through all of this first, right? Because I want to know what the story is, right? We need to write it out, and we need to have the analysis plan down. Because once we know what the result is, given that we have done this, we have to publish it or try, right? Because what people will do is they'll hear something, maybe they'll see something on social media, they'll hear something at a conference, and they'll say, oh, we have some data that we could probably analyze this. And then they'll do it, and they don't find it, and they go, probably nothing there. Maybe it wasn't really designed to answer that necessarily. That's probably why we didn't see it. But it's like, maybe that was the one-off, right? And if you would have done it, these studies would have been accumulating. And I think that's where a lot of the publication bias comes from. I don't think it's necessarily like we did a study, we didn't find anything, and therefore we're not going to do it. I think a lot of times we have some of this data setting here that this person's saying that there's a link between these two. Well, let's run it. Oh, we don't find anything. And then they just forget about it. I think that's a bigger portion of it.
Yep. No, I think what you said, yes, there are some bad actors in science, for sure. Absolutely. And I always say this to people, the scientific method is perfect, but it is done by humans who are imperfect with their own personal beliefs, their own biases. You and I would readily admit we have our own personal beliefs and our own biases, and those cloud our judgment. Absolutely. Which again is why we care about replication, because I'm seeing this really like anti-scientific study stuff now where people are like, I don't care about scientific studies. And it's usually once you've like posted, multiple meta-analyses that refute whatever they believe, right? Like, well, you can't trust studies because they're all bought and paid for, blah. And what I say is, well, so what are we left to rely on? Do you think that your feelings are a higher form of evidence? Because scientific studies are definitely not infallible and they have their problems. And so does scientific publications. But I'm willing to bet it's better than how you feel.
Yeah. Yeah, I would say yes.
Because the whole, like, here's a line that I said many times until I got to a certain point and stopped saying, well, it makes sense. It makes sense that. Because the number of times I've said it makes sense only to find out that it didn't work that way in research, it would be mountainous. It would be mountainous.
Well, yeah, to your point, if everything was intuitive, you would never need to do anything.
Right.
It's like, well, this, of course, because like blood flow restriction is the biggest example. Nothing about that makes sense. Nothing.
Right. Blood flow is important. Why would you restrict it?
Yeah, exactly.
You're using lighter load. Why? I mean, and just like, when it comes to, again, I want to press on this point again, not to like make the claim that scientists are infallible because they're not. But again, I think this idea that like there's this deep, dark, sinister, coordinated effort on some of the, no, it's isolated cases, sure. But like people say, well, you're more likely to show a positive result with industry funded studies. Well, yeah, no, duh. You know why? Because let's take my research, was funded by the Egg Nutrition Board, the National Dairy Council, and the National Cattlemen's Beef Association, right? If I think leucine is important for muscle protein synthesis, and I believe that, and there's precursor data to show that, who am I going to go try to procure funding from? Am I going to go to like collagen supplement companies and wheat protein and lower sources? No, I'm going to be going to sources of protein that are high in leucine, which are typically animal sources of protein. And if my theory is decent, then I may show positive results from that. I can tell you, I was in graduate school for 6 years. I met exactly one person from any of those places. It was at a scientific conference. The conversation was 15 seconds, and it went like this. Thanks so much for funding my research. I really appreciate it. You're welcome. Thank you for doing good work. Nobody was like over my shoulder in the lab while I was pipetting, like, right. hey, you might want to put a little bit more in sample 7A. No, right. It just didn't happen like that, Yeah. And so I think what they think happens is usually not what's really happening.
Yeah. And, it's science, especially depending on what you're doing, requires money. And that means it's coming from the government, or it means it's coming from the private sector. So which one would you prefer?
Well, we don't trust the government, but also we don't trust industry. So therefore, you can't win either way. And then God forbid you self-fund something, you know what I mean? If you're like a really rich person who cares about this stuff. Yeah, it's just... It's a no-win situation with some of those folks. And again, I would say science has its scientists doing the scientific method have their problems, and it has its limitations, and it is not a perfect system, but it is damn well better than feelings, because feelings got us to about the 1700s. And we weren't doing so hot with our understanding of the world up to those points, At
least not in Europe. Yeah.
Yeah. Okay. Final question, and I ask this of all my guests. What is a belief that you held very strongly that you later changed your mind on based on evidence?
One of them we talked about already is the muscle growth and strength change connection. I think another one is I got really interested in the low load exercise, and I still am interested in the low load exercise. And I think I got sometimes to a point where I started to go in line with low loads are the same as high load exercise for growth and strength. And it's, you just got to measure strength in the correct way. It's like, usually that means in a way that is different than the task of which they're interested in getting stronger in, right? And, the way that this is framed, and I get what is meant when they say this, and my analogy is not foolproof, right? It's just, it's not even my analogy. I took it from one of my students. We talk about this a lot in lab, where if we talked about collagen protein, for example, in the same way that some people talk about low load exercise, people would burn the internet down, right? Because what people will say is that low loads are just as good as high loads, right? You just gotta practice lifting some high loads every once in a while, right? Which is right, but it's like, if we did that with collagen, it's like collagen's just as good as whey. If you just take whey just a little bit, right?
Just put some leucine in it, yeah.
Yeah, it's like, well, isn't that, then you're just doing whey. It's like, yeah, exactly, right? Now, what they would argue is that, well, collagen, as you said, doesn't serve any purpose. But we know low loads can increase growth and endurance, so it's not a one-to-one comparison. But in my mind, I think I think it's a point of real contention why people go to war over low load exercise, and I think that's because people will read what some people say and go, okay, low loads can induce growth similar to that of high load exercise. Fine. And then somebody else will say, and it's just as good as high load exercise for strength. And anybody who lifts weights knows that that's nonsense. And they're like, that's not true, right? So it's just easier to say low load exercise can produce growth similar to that of high load exercise, and it can increase strength, but it's nowhere near what it is with high load exercise. But a follow-up to that would be, for some people, it probably doesn't matter.
Right.
Most of the everyday tasks that people are doing are at super submaximal intensities. And of course, yes, if you got stronger, it would be more submaximal. But it doesn't need to be that much more submaximal. Endurance is probably much more important, right? Muscular endurance. But anyway, that's what I would probably say after I just pissed off everyone.
No, it's great. I think the point I would make here is, people saying, well, you just haven't tested it right. You got to do this, you got to do that. I was reading, I think John Speakman said this, and he was debating somebody on the carbohydrate insulin model of obesity, and their comeback to all the plethora of studies that prove that this hypothesis is wrong. And then they shift the goalpost and just make the hypothesis just a little bit different, so it's not wrong. He said, if your hypothesis requires such tight constraints that it can only be supported under very specific circumstances, it's not a very robust hypothesis. And I think that is a good kind of, point to make here. Like, things that we know to be true in science, we can't know anything to be true or even this reality to be true, but we can have data that we're pretty confident in. We have a high degree of confidence. Data we have a high degree of confidence in, we have because it's true across a lot of different demographics and a lot of different situations under a lot of different conditions. You don't hack your way out of it. And it's funny, you were talking about, you could have just as good, if you just do some, 1 rep max training here and there. It reminds me of, I was reading, people send me this stuff all the time. I got an email from somebody who sent me an article about carnivores and raw milk consumers who are concerned about some of the infections that have been going around and are talking about, you know what, you can heat milk and it will stop. And I'm like, you mean pasteurization, you freaking idiot? Like, it just gets to the point where you're doing some of these folks do such mental gymnastics that they don't even realize how fast they are twirling through the air.
Yeah, but I was someone who was doing that with low loads and strength, right? I was doing those gymnastics before, and you've talked about this too, and I know I have previously. It's like when you start to change your mind, it's not like you wake up tomorrow and it's like I'm a new person. It's like you slowly get called out enough, right? And you're like, and you start to see it. A study gets published. Okay, that's interesting. A study gets published, and then maybe one of your students brings up something else, just a different way of phrasing it, and it's like, man, maybe I need to tweak how I'm approaching this, right? Because I even got that in a review comment. Someone's like, you're talking about low loads being similar to strength as high load exercise. But there are these other situations where that's not the case, and then you read those, and it's like, okay, I think this person's right, that's when peer review is working correctly, right? There's been, I never get comments, and I never get them and go, oh wow, that's a great point. My first comment
reviewer number
is usually,
2. Screw that guy.
What is this person talking about? This person doesn't. But then, you'll read what they're saying, and for me, it takes me a couple days, because there was something very important one time where this person's like, I don't think you're quite doing what it is that you think you're doing. And I'm like, what is this person even talking about? Because we literally did this approach because we wanted to do this. And then I read that paper 4 times, and it's like, oh, okay, yeah, I think that person's correct, right? This is what this person's saying. Then you got to go back. It's like, hey, that person's actually not an idiot. I'm an idiot, right? But I've had that about hormones as well. Listen to Stu Phillips, where it's like, okay, maybe these, but even how we talk about that's got to be nuanced, right? Because I think people mischaracterize, and I probably mischaracterize his viewpoint as well, where I'm like, hormones don't matter, right? And it's like, no. The change with acute exercise doesn't matter. If you were to take it to 0, it would matter a lot. Right? It's like I was mischaracterizing what it is he was saying.
Right. And that's, I see people do that. That's those kind of straw mans all the time. I've been guilty of that as well. You're saying hormones don't matter? Well, if you had no testosterone, you wouldn't grow muscle. Well, no, I'm saying that the rise in testosterone, this acute rise in testosterone in response to exercise, is not anabolic. And the data now we know very clearly shows that. So, you bring up great points, and I want to just highlight one last thing for our listeners, which is, honestly, if you are doing science well, you don't change your mind quickly. It is a slow process. It, quite frankly, should work like how politics work. It should be a very slow, grindy process where you're you have something where you go, that doesn't make sense with what I think. Okay, and then if you are, everybody has this. You can get defensive. I've been guilty of this. I'm sure you have as well. But if you're a good scientist, at some point you settle in and you go, okay, let's explore this. Let's go back to curiosity and try to come up with an understanding. How can I reconcile this with what I've observed and what I think? And over time, your understanding improves and your thoughts shift. And I'll tell people, you don't want to just like you said, wake up one day and go, I'm a changed person. I think this. Yeah. Because if you do that with every single scientific research study, you'll be like a ping pong ball going back and forth, right? You want to take it slow and try to find the common thread and slowly evolve your thoughts. And that has been my progression of what I believe over time is a slow change of my mind. And if you're doing science right, that's probably what it should look like.
and I don't know, you can't see it, but there's a book of samurai up on my bookshelf, and it's got a passage where it says the man at the highest level of learning has the look of knowing nothing. Right? So
one of my greatest, my favorite quotes is by Bertrand Russell, and he said, "The whole problem with this world is only fools and zealots are sure of themselves, and wise people are filled with doubts." And yeah, I mean, I think you said it. I saw you quote it one time. When you drink from the fountain of knowledge, you will thirst for the ignorance you once had. There is nobody more confident in their knowledge than somebody who's like just about to finish their undergrad. There's nobody that has more confidence that they know all the answers than that person. And if you do a PhD or a graduate program right, or you just are intellectually honest, over time, you realize that you can have things that you're relatively confident in, but there's very few things you're going to bet your life on.
Yeah. And it's also one of those things where there are certain things where you're just going to disagree.
Yep.
Right? And it's one of those things where it's like, I think this. Okay.
Yeah. Now, you're not allowed to do that now, Jeremy. You're not allowed to do that. If you don't agree with what I think, I hate you and I want bad things to happen to you. We are not allowed to respectfully disagree.
And you're evil. Not only that, you're evil.
Exactly. You're evil. If you don't think hypertrophy contributes to strength, you're evil.
Yeah.
Hey, man, this has been great. Thank you so much. If you want to, where can people find you on social? If you're on social, are you taking graduate students? Is there anything you want to plug?
I'm always willing to talk to graduate students. Funding is something that's always the question mark. But I would encourage people who are interested in what we're doing to reach out. If you want to work hard and you want to think about science critically, then you might want to consider our lab. It might not be for you, but you can find me on Twitter. I'm not as active as I used to be. Instagram, Facebook, I'm on all of those at JP Loenneke. Facebook is, I think, just my name. It's a whole different world than it used to be, or at least what I perceived that it used to be. Who knows if it really is different, but it feels different, the social media thing. I'm still on there, but I don't approach it the same way. But you can reach out to me through that. As far as anything else, PubMed, you can search my name. You can find our lab's work. And as I always say, my students, and you know this as someone as a former student, they do basically all of the work. They challenge me probably as much, if not more, than I challenge them. So I think it's that collective group. But it's like these ideas that we're talking about, even some of the analogies. I'm not coming up with all this stuff on my own, right? I have great students. And past and present. So, yeah, I'm not selling anything other than good science.
Yeah, I mean, I think you have one of the best scientific mindsets I've come across, just for that. And when he says work hard, you can just look at the stack of papers in the background. And my guess is those are studies that Jeremy has read in the last couple of months and not just the last year. So, yeah, you'll definitely be working hard. Hey, man, thanks for doing this. This was a lot of fun, and it was great to catch up.
Yeah, appreciate you having me on.
All right. Jeremy Loenneke, ladies and gentlemen, thanks for listening.